You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
McLellan, thank you for being on the Patient Advocacy Now podcast. I'm thrilled to talk to you. You have nearly 4 decades of experience in the healthcare field. I think where I want to start is you started your independent patient advocacy practice in 2020. What was the impetus? Why did you go from nursing to deciding it's time to shift to independent patient advocacy?
Good question. 2018, we left. My husband retired from 25 years of AT&T. We bought an RV and we decided to travel the U.S. for 2 years. And I did travel home health. And in our travels, we were staying in RV parks. And my husband, God love him, would brag about me as being a nurse. And most of our RV parks have people 65 and older in them. And they would all walk up to me with their list of ailments and what's going on and how can I help them? And then my husband said, there must be a market for this. And so we started researching and found that there is a market for independent advocacy. And then, of course, our world got hit with the pandemic. Home health got hit hard. So travel nurses that were in home health, there was no work for them because they were doing all they could do to put their own nurses to work. Because when they canceled elective procedures, nobody was getting hips or shoulders or whatever. So that's when I came back to Texas.
Just to put a pause for a sec. When you say you were a home health nurse, for people not in the nursing industry, so were you working under the umbrella of a hospital? Were you independent at that point?
Nope. So there are home health agencies that provide nurses to the home setting. And when I say travel nurse, basically we would travel the country. I would look for an assignment that was about 13 weeks long and work for a company in Florida in the middle of winter. So I could be in a beautiful place, right?
Yeah.
Or up in the Midwest in the summertime. So I could be in a cool place. And so we got to travel the country while I was still working.
It's like being an Uber nurse. You just kind of decide where you want to drive,
Yep, for sure. And so when we came back to Texas, I have a company here that I was a supervisor for, and I was doing all of their recruiting while I was on the road as well. And they needed a nurse in the field. So I said, okay, I'll be that nurse, and came back to do that, and then started studying for my PCBA and took my test in October and passed. And we opened my independent advocacy practice in December of 2020. So it was the traveling and seeing all the people that needed help, that couldn't find the help. And that I realized because of because we're short-staffed, overworked, underpaid, there's Medicare and Medicaid cutbacks left and right. A lot of people don't understand that nurses and PTs and OTs, their paycheck or their salary is determined based off of what health insurances pay hospitals or home cares. So if there's cutbacks, you're not getting a raise. In nursing, if you've been a seasoned nurse like I have for years, you haven't seen a raise in 20 years because a company can't pay you more than they're getting reimbursed. So that kind of was the litmus for me to say, okay, let's do this.
So it sounds like it was a combination of both a business opportunity, but also seeing that there's so many people who need help and just don't know where to get it.
Absolutely. And I was helping people while I traveled across the country for free. And I don't mind doing that. And to this day, I have 10% of my profits that come in my business, I put aside as a benevolent fund so that if somebody needs help and they can't afford it, I set aside funds to be able to help people pro bono.
You kind of tithe your own time that way.
Yeah, I tithe my time and my money and my business, not only to God, but to people who need it. Mm-hmm.
Yeah, I think that's beautiful. Where have you found yourself most surprised moving into the advocacy space?
I think the biggest surprise that I have found recently is I am shocked and appalled at hospitals declining, refusing, feeling as though they don't have to give patients a list of their meds, what they're taking them for, the side effects to them, why they've been prescribed. And I have found that.
So that's never happened to me personally. Give me an example of this. Like, let me, because a lot of people hear that and go, that can't be happening, because we just don't have that experience, some of us. And I'm sure there are people listening going, that absolutely happened. But for those of us who haven't had that unfortunate experience, walk me through how that happens and how you as an advocate know that happens.
So about 3 months ago, I had a client who reached out to me. It was a gay couple. And the partner reached out to me and said, hey, we're in the hospital. We have been in the hospital for 6 weeks. The patient, the partner's husband, spouse, had a debilitating diagnosis of cancer, multiple lesions in the brain. There was some other diagnoses that were personal that they wanted to keep personal. And one of the reasons they reached out to me is they said, we have all these medications and we don't know what they are. We don't know what they do. We're not sure what's happening. Nobody's talking to us. And so I met them. I met with them, did the initial assessment. They brought me on board. And when we went to the hospital and met with the nurse and the charge nurse the very first time I was in the hospital, and I requested for the partner a copy of the medications, the direct words out of the charge nurse's mouth is, we cannot give that to you. You're going to have to fill out a request for medical records to get that.
They wouldn't give you a list of all the medications he was on.
Right. And honestly, I didn't want them. The partner did.
The partner wanted them.
The medical power of attorney, the actual client, because of the lesions on the brain, was considered unable to really help himself because he was having seizures and, he just wasn't alert and oriented. He was incapacitated to the point where his partner had a signed medical power of attorney and was the one that was kind of taking care of him. And I was just floored. I was shocked. I had never in my 30 years of nursing.
And let me ask you, do you think if the patient wasn't incapacitated and he asked for it himself, they would give him a hard time as well? Did it come because it came from a spouse? Do you have any idea?
So I would like to say that was the case, but I have 3 other examples. One was literally 2 weeks ago, a 21-year-old young lady in the hospital. They're trying to rule out a disease called POTS. I don't know if you know what that is, but it causes some syncopal episodes where you can drop and pass out. And the interesting thing is she presented 50% POTS, 50% not POTS. So it was kind of like a show of Dr. House, right? We're trying to figure out what really is going on here.
Yeah.
21-year-old young lady that grew up in the foster care system, has a 3-year-old daughter. So she's been abused, neglected in untrustworthy places for most of her life.
Sure.
And they were not giving her a list of medications that she was taking. The nurse literally came in the room and said, here's your pills. Let me scan your watch. Here you go. Or her band to, document she was giving them.
Yeah, sure.
Yep. And the young lady said, could you tell me what I'm taking? The nurse said, well, this is the pills the doctor ordered. So I stopped her and I said, stop right there. Please tell me what those pills are. Tell your patient why they're prescribed and why she's taking them. Here's the sad part. The nurse didn't even know what they were because they're unique to the disease. And I'm okay not knowing. Look it up. Say, you know what? I've not heard of this. Let me research it, and that happened right in front of me. And so
what was her response? The nurse.
Silence. So, and then when I said, well, could you tell them, can I look at them? She said, well, are you on her PHI, patient history information? In some hospitals now, they have what they call emergency contacts, and then they have PHI. If you're an emergency contact, you don't get any medical information. You can only get medical information if you're a PHI.
What's the point of having the emergency contact without the PHI?
Please answer that question for me, and we'll answer the $1 million question. So, thank you.
Your husband or wife is sick. Good luck. I mean, like,
Yeah.
I don't understand.
So the patient was sitting right there saying, please tell my advocate what the drugs are so she can explain it to me. So she did tell me the name of the drugs. I was able to explain it to her. And one of them I had to look up. I wasn't familiar with it. I'm not saying we have to know everything. We can't possibly know everything.
But if you weren't in the room,
that wouldn't have happened. She would have taken pills and not know what she took. And for all you know, she could have took wrong medicine. Because a lot of people say because we scan the band that there's no way we can mess up. But there's override systems. If a doctor writes a acute PRN med, a nurse can override that and give it and accidentally give a wrong med to a wrong patient.
Yeah. And I've seen it firsthand where people are at a surgery and they have to sign paperwork and they don't have an advocate or a loved one there. And I've been visiting as a friend and they're signing things that they have zero recollection of, that they have zero ability to comprehend because they're still, recovering from the anesthetic.
That is very correct.
So how do we fix that? How do we fix this?
One of the ways that I'm looking to fix it where I'm at, I'm in Texas. I'm in North Texas. I say Dallas because everybody knows where Dallas is, but I'm in a town called McKinney, so it's north of Dallas. One of the things I'm working on is meeting with my local Congress and Senate because I would like to work on a bill that states that every person can have an independent patient advocate, whether it's a paid advocate or whether it's a family friend or whatever. Mm-hmm. And that when they go to the hospital, that the hospitals have to speak to them and talk to them, provided the client who's hired them has said, yes, I want this person to fight and to not fight, that's the wrong word, to educate and to be here to help me understand what's going on with me. Mm-hmm. Because I feel like we have to start with our government, and that's a whole nother sticky issue. So
yeah, but I hear what you're saying. If there's legal red tape, it makes it harder for them to kick you out of the room, makes it harder for them to deny information. And so that it kind of arms you with those tools so that you can advocate more effectively for your clients. Is that really the whole idea?
That is really the whole truth. And I do want to back up. I don't want to make it sound like hospitals are doing something wrong. We live in a very electronic age. And so there's so much fraud that can happen electronically that honestly, I think that these things that are happening are being put in place for protection, but we got to figure out
what kind of fraud are you talking about?
For example, if I were to fax in a release of information, it's real easy to forge a signature, send in a release of information and say, yes, I'm this person's advocate or whatever. I'm just stating that as an example. Mm-hmm. We know that that can happen. So what I'm saying is for hospitals to want to hear it from the client or the patient makes sense to me. But once that's happened, we're still fighting a battle. You know what I mean? And so I guess what I'm saying is that I think hospitals are trying to respond, and doctors' offices, to the fact that we have so much elder fraud. We have so much medical chances of fraud, mm-hmm. that this is their way of fixing it. But in their way of fixing it, I feel like they're compromising patient rights.
Got it. Do you feel like all the legalities and the fear of being sued and fear of fraud has really been detrimental to the hospitals as well as the patients?
So I think that's part of it. And I think the word advocate for healthcare advocates, navigators, I think it brings up kind of like, oh my gosh, are they watching my P's and Q's and am I going to be sued? So we have to do a better job of educating our hospitals and doctors' offices. And this came up yesterday. I had that same 21-year-old was going to be discharged, and it came out of nowhere. And in the discharge planning, because I wasn't the PHI, I was only an emergency contact, they didn't want to talk to me. And I said, great, you don't have to talk to me. Let me talk to you. You can't give me information, but I can give you information because the client has said I could. And number one. Number two, pick up the phone, call my client. She'll tell you you can talk to me. But that was too easy. The caseworker didn't want to do that. So I basically said, listen, I have zero problem with discharge. What I want is 30 days of meds, a follow-up cardiologist, a follow-up PCP, not a name, not a number, an actual appointment in network with this young lady's Medicaid, so that she doesn't get discharged and she doesn't really have an appointment, because that happens a lot. They just throw a name on a paper and they say, call them, work it out. But what they don't do is they don't check the insurance. And because she's from the foster system, she has Medicaid and she has one of the lower paying, harder to find in-network doctor insurances. So I wanted to make sure that was happening. I also wanted her to have a wheelchair, a walker, a shower chair. She's got this syndrome that she can pass out from. She needs to have the ability to, and be safe. Yeah. And so I said to the caseworker, I said, I'm not trying to stop the discharge. I'm trying to make sure we get everything. And I was there on Monday and there was no talk of discharge for Wednesday. If there was, I would have said all of this on Monday. So here we are, 4:00 in the afternoon, and they halted everything. I called the doctor. They got everything I requested for the patient to be discharged, and she got discharged about 5:30. In doing that, what I said to the case manager is I said, look, I'm not here to fight you. I'm here to help you. If you need me to call the insurance to find out what doctors are in network, I will do that for you. I know that you have 50, 60 patients. I have one, her. So let me help you help her. So I think we've got to do a really better job of educating the people. And I think they hear patient advocate and they freak out and they're like, oh my God, they're here to see everything I'm doing wrong. No, we're here to prevent mistakes and to help you. Right. And to help the patient, because neither one of us want that client back in the hospital, right? And with the new rules, if you're back within 30 days with the same diagnosis, insurances are trying not to pay. Rightfully so. So let's do it right the first time. Yeah. It takes a little work.
You being a nurse, I mean, you could probably empathize with the idea that if you're kind to the nurses and you let them know this idea that you are on their side, it just makes everything easier. I mean, I was told by another advocate, it was a brilliant idea, is bring candy for your nurses and bring them treats, but keep it in your room so that they come to you to get the candy and you get those constant check-ins.
Yes, I do. There's something out here called All About Bunts. They're little tiny cupcakes. I call them All About Butts because I feel like it goes right to my butt. But so whenever I have a client in the hospital, I buy 20 of those mini or 12 of those mini cupcakes. It's like $20. So it's super easy. I bring it to the nurse's station, but then I also bring something for the client to have in their room. So when the nurses or the doctors walk in, they can offer them something, and not a lot of money. But enough. Yeah. Listen, if you feed a nurse, they will come. You know, the movie with the baseball field, build it, they'll come. When you're in the hospital, you bring food, they're your best friend. Yeah. And you want the nurses on your side. Number one, they're the ones that are with you most of the time. They're the ones that are taking care of you. And they're the ones that will fight for you with the doctor. So as much as, yes, you want the doctor to hear you and be on your side, if you've got the nurse on your side, the PT and the OT on your side, the doctor will come around.
Yeah. What have you learned as an advocate now that you've been doing it for a few years that you wish you knew as a nurse?
Oh, good question. You know what? I'm going to be totally honest. We always say when you come in the hospital, it's your choice. You have a right. But the reality is in the hospital setting, we run the show. The hospital makes you feel like it's your choice and your show, but really if we've got a med pass at 7 a.m., we're passing that med at 7 a.m., even if you don't want it at 9 a.m., because we've got 20 other things to do. Is that right or wrong? No. How can we fix that? I really feel like it's just a conversation. Hey, I don't really wake up and eat my breakfast till 9. I know it's asking a lot for you to put my 7 o'clock med off till 9, but can we ask the doctor if that's okay?
Mm-hmm.
I know that you have to take vital signs every 4 hours. I'm in here for regulation of my Coumadin. Could we get an order from the doctor that says from 12 p.m. to 6 a.m. that I can sleep without being interrupted? So there are things like that as an advocate, I've helped people fight for that I didn't necessarily. It's a different mindset because when you're working in the hospital, you have things you have to do. You have rules you have to follow and schedules. And honestly, especially today, you're getting 5 to 6 patients if you're on day shift, sometimes 7. And at night, you might have 8 or 9. And you just cannot adequately take care of that many people. So those patients that have family members there, when I was in the hospital, I was very grateful for them. And I would say, listen, not your problem, but this is how many people I have. If you see something and I don't catch it, please come get me. If I'm not answering your call bell, please come get me. Today, we have a lot of young nurses. Typically, when you go to nursing school, you're like, oh, nurses make great money. And when you're 23, yeah, they make great money. When you're my age, you're coming out of school and you're making what I make as an RN. That's a little frustrating to me. But the other side of that coin is we have a lot of people going into medicine for money. And you can tell the difference. When I'm in a hospital setting and a nurse comes in, I can tell if she's in nursing for the money or for the client.
Just
and that's
by the
also
passion or
passion, lack of empathy, and so because of that, and because of the pandemic, a lot of our nurses that we have now were trained on simulators and online. They weren't trained with real human beings. So they have not learned, the dummy doesn't talk back, right? So when you're teaching a skill.
And it doesn't have a difficult mother,
Right. So we have a lot of medical people that are in healthcare today that were trained during the pandemic. And I would question, were they really trained? Because we did the best we could because we still need people.
We're still short nurses. Yeah.
Oh, the state of Texas has lost 1.2 million medical staff since COVID, whether it be because of COVID, whether it be because of vaccine mandates, whatever the reason. And no new people are coming in as quickly as people are getting out.
Yeah.
So, it's because of that alone, you need an advocate. And I have really found, I only had one case out of the medication issues where the hospital just flat refused. The other cases, like the young lady, I was there on Monday or last Friday, the doctor came in and I said, hey, doc, they're not giving us a list of meds. And his response is, well, our system doesn't let us print it unless it's on discharge. I said, that's great. Can you read them off to me and can I write them down? And then can I get education forms myself for the client? He was like, absolutely. Well, he read them so fast. It's a good thing I was a nurse for 30 years because I knew most of them and I could write them down. So at least he was able to do that for me. And he understood what I said when I said, this is a patient right issue. And you're asking your client, how did that med make you feel? Do you feel less dizzy? Do you feel less this? She goes, which med? What are you talking about?
You know what's so fascinating about the advocacy space, as new as it is, and it's really in its infancy, because there are individuals like yourself who come in so qualified because of their experience in the healthcare system, even though it's a new and kind of brand new, space, the experience is so vast because you touch on so much that your history brings to the table. And you've dove in essentially kind of head first into this space. I know that you've been like a speaker on some panels. You went to a summit in NOLA. How have you watched? How has the industry changed? How have those summits changed like year to year? Do you see it kind of changing in drastic ways? Is the growth still kind of slow? What would you like to see changed? I mean, I'm really kind of curious about the industry as a whole from your perspective.
So the Healthcare Advocate Summit this year, in my opinion, was phenomenal. So I want to say, what year are we in? 2023. So
Yeah.
2021, the first Healthcare Advocate Summit was in Galveston. I want to say there was 3 independent advocates there. In 2022, it was in NOLA, and we had 10 independent advocates there. This year, it was in NOLA, and we, and I will say, Greater National Advocates, Chicao, the Board Certified Patient Advocate Committee, everybody really promoted the Healthcare Advocate Summit, and they actually created an independent track. And I want to say, I could be off of my numbers, but I want to say we had about 150 independent advocates there.
No, that's explosive exponential growth.
From 10 last year to,
well, from 3 to 10 to 120.
Right.
Yeah, it's huge.
Yeah. And when I took my BCPA in 2020, we had less than 1,000 certified patient advocates. Now I want to say we're hitting close to 2,500, 3,000. I don't know the exact number. I'd have to get on their site to look. So it's becoming a talked about subject, to the point where at the summit, there was an educator from a nursing school that wanted to kind of promote independent advocacy in a school setting. I have opinions about that. I feel like it's hard to be an independent advocate coming right out of school without any medical experience at all. So unless you're a person that's in school that's taking care of a sick loved one or something like that, I'm not sure how that will play out, but I think it's awesome that people are looking at it and talking about it and wanting to create a curriculum around it. And so I got to speak with that instructor just a little bit briefly, and I love the ideas that are formulating. So I think we're going to start seeing this become an avenue for people. The question's going to be, and the question always is, we have probably, not even probably, we definitely have way more people that need an advocate than can afford a private independent advocate.
Yeah.
And so one of the other things that I believe all advocates are trying to do is figure out a way to also get the needed help to those that can't afford it. I know that we've got
that's a
care partners
issue that comes up constantly. I mean, everybody keeps saying the same thing, is like some of the people who need it the most just have no means.
So I feel like, and I network in Texas with several independent advocates, and most of us are faith believers, and most of us have set apart a way to help people like that. You also have the side of the coin where people say they don't have the ability to get the help, but they're, throwing money away on cartons of cigarettes or alcohol or whatever. And my attitude is, I will help anybody, but let's put money where your health concerns are. And if that money is only $10, I feel like a person will value what they get from you if it has to cost them a little bit.
Yep.
And also if they have to have some skin in the game.
So, the old expression is, if you're not paying, you're not paying attention.
Right. And so I have people that, like I said, I put 10% of my profits aside to help people that need the help but can't afford it. And I have a little form that they fill out that kind of talks a little bit about their expenses and what's coming in. And I do a couple of things. My husband is great at finance, and he retired at 50. So if they're open to it, I let them sit down with somebody on how can we help your budget to work good for you if they want to. We can't make them. It's an
Right.
option that we offer.
Right.
And then the other thing I do is I do give a discount, and I'll do it for, say, 45 days. And I will tell them, here's what I'm going to do, and here's the homework I'm going to give you. So I'm going to help them, and I'm going to give them tools to help themselves. And where somebody who just wants to pay me because, for example, I have a client who's a lawyer and I take care of her mother. And she says, I can do this, but can I just pay you to do it? Well, she has the resources to do it. So sure, I'll take your money and I'll do it
Right.
for you.
Right.
On somebody who doesn't have the ability to do that, I give them the tools to help themselves. I give the other people the tools too. But if she's like, I have the resources to pay you, then I'll take your money all day long.
Sure.
Over here, I'll give you the tools and I'll say, hey, call your insurance. Be prepared. You might be on the phone for an hour. So I'm going to help them. I'm going to discount it. I'm going to do some pro bono. And then they're going to be set up, hopefully, the next time to be able to help themselves better. I give back in my church, my leadership staff, my pastors. If they have any need, I help them pro bono as a way of giving back to my church. My pastor feeds me spiritually. If they need help medically, I will do pro bono for them. So I have ways to do it.
And you hear that a lot in the space, that people, the ones who didn't go into it for the money, which is the vast majority, because it's not one of those things like a nurse where you just get plugged in and get a salary. You still have to work for it. There is a passion to help people. And so you do see, most of the advocates I speak to did start by working for free just because it was like a default place. And then they're like, well, I can't afford to live and do this for free. So let's figure out the business side of things. Before we jump in, because I know you have a lot of good experience on that side of the world as well, in terms of the business and kind of structuring things. Just to finish up on the summit, do you have any highlights, and would you recommend it to people in the advocacy space for next year?
I would absolutely recommend it to people in the advocacy space. And I would also say, if you're considering becoming an advocate, go to the Healthcare Summit. I think next year it's going to be in Vegas.
Mm-hmm.
And I will say, Greater National Advocates, Brad did an incredible job of having a great corner section where people could come and meet with advocates and talk with advocates, and also has updated the website. And if you don't know, as an independent advocate, you can have a profile on Greater National Advocates and it doesn't cost you a dime. And it's a great way not only for people to find you, but it's also a great way. I have people that call me and say, I need an advocate in Washington State. I can get on Greater National Advocates and I can look for an advocate in that area. And I can refer out. And if there's not one close by or whatever, a lot of us do remote and can do nationally. So if I can't find somebody close and boots on the ground, I do say to them, hey, call me back, because it doesn't mean I can't help you. It just might look a little different.
Right.
And so to me, the highlight was, that corner, but also Chicao had done a survey on people's responses to advocates. And that survey, the results were incredible. And I would encourage anybody to get a hold of that and read it. They did not pay anybody for answers. So I feel like the results are probably...
Can you give us the elevator summary pitch of what you found?
Ooh, I might do a bad job. I think they were asking questions like,
just the sentiment.
Have you used an advocate? Did you find them helpful? And I think kind of the summary was from doctors, from patients, and from hospitals that they were well received, more than not. And that people felt like they were helped and that they would benefit from continuing to use an advocate. And I'm going to use that research when I meet with my government officials. So
yeah, that's good ammunition for sure.
Yeah.
So your advocacy company is called SunNav. What's before we dive into exactly what you provide, where's the name come from?
I love that. So God talks to me in butterflies. And probably 30 years ago, I was in a small group setting with 4 or 5 women. And personally, I was battling with some personal trauma, abuse trauma growing up. And these women were praying with me and encouraging me. And one day, one of the ladies showed up. She actually happened to be my young adult youth pastor. And she had, and I actually have it, she had a stained glass butterfly. And she said, Terry, I was praying for you. And God told me, don't try to be perfect on earth. So if you know about a butterfly, butterflies are first caterpillars, and then they go into the cocoon, and they're in that cocoon and they morph, and then they break out. And when they break out, they're a butterfly. But if you help that butterfly break out, it will die. So you have to let it do the hard work of breaking out. So ever since that was given to me, what I felt like the word of the Lord was for me is don't try to be a butterfly on earth. You'll get your wings when you're in heaven. So you're constantly working on being that better person. Well, then when you look at the butterfly and how they operate, they navigate by their antennae, and they know where the sun's going to be and where the dark's going to be by their antennae. And because we are navigators and help people navigate the healthcare system, I just felt like it was a really great way to name a business, have an icon that I love, and colors I love. So sun, so butterflies are navigated by the sun. As an advocate, I'm going to help you navigate the healthcare system in its brightness and in its darkness.
And
And
your
for me, it's a
cocoon
little
was
bit of a
30
play on
years.
words because
Well,
sun.
I totally get it. I think it's beautiful. It's beautiful. And I was going to say, like, your cocoon was 30 years in the medical space. And so you emerged. And so now you're the navigator helping people kind of stuck in their own muck a little bit. I think it's beautiful. You don't just offer advocacy services, and this is really interesting. So you offer coaching because it's such a new field and because it's such a different way of going about helping people, right? You're not, like I said before, plugging into a hospital and becoming a nurse and getting a salary. So a lot of people kind of get confused as to how to get off the ground and start their business. And you've developed a coaching program. Is that right?
Yes, sir.
So tell me more about that.
I call it Sun Nav Equip. And I do want to say there are multiple resources when people are like, how do I get a website? How do I get the education, the BCPA? That's not what I do. What I do is once you have gotten all of that under your belt and you're probably still working full time and starting your business because you're like, okay, when do I jump ship and go full-time business? Because I still got to put a roof over my head. And so what I do is I had been a part of a lot of independent advocate kind of encouraging groups, and we all help each other. And my husband actually said, Terry, you're doing a lot of coaching and there's probably a space for this. And so I got my first 2 clients kind of before I even developed a coaching program where it's like, okay, why did you start? What's your why? Where are you at? What do you need help with? And then other things like you're enough. You have what it takes. Rely on your education and your background. So I created a 12-step program and when I call it coaching, it's really kind of more like encouraging you that you got this vision and the vision isn't wrong. And you've got all the things in place. Now you need the next step, which is finding the clients. And sometimes in finding the clients, you have to be comfortable in your own skin. A lot of us as nurses, we're helpers. A lot of us were codependent. So when somebody comes to us and says, I can't afford to pay, the first thing we want to do is help them for nothing. And I've had to learn to get a little tough skin and say, okay, let's look at what can you afford, and let's really have those hard conversations. So I help people learn how to get their 30-minute consultation to 20 minutes and close the sale. You know what I mean?
Right.
And God has gifted me in that, and I can help other people do that. So we call that SunNav Equip, and I'm able to help people. We have a client right now out of New Jersey that we're working with, and she actually started a nonprofit advocacy business, and she's like struggling with getting grants and stuff. And one of the things that we talked about is, okay, let's have a subsidiary for-profit advocacy business so that you can funnel your nonprofit with your for-profit. So that's kind of one of the things we talked about. And I met her at the HAS conference. So another reason to go to the HAS conference, because you learn and meet, other people. And that was one of our first meetings, and she's already emailed me a couple of times, and she's like, oh my gosh, you've been so helpful, so great, so wonderful. And this is what we're going to do. And I can't wait till our next meeting to talk about next steps. And I just kind of slow it down, because sometimes we think so globally and we want the end, but we got to go through the first 5 steps to get to the end. And sometimes you've got what it takes. You just need to be told you got what it takes.
Yeah.
So that's what I do. And I believe in doing it affordably. It's $1,200 a year, which is $100 a class, 1 class a month, and you get multiple emails, texts, phone calls. I'm not out there to make a buck. Advocates are trying to get a business going. I'm not trying to, bleed you. You know what I mean? I'm trying to encourage you. So that's what I do. And I also, fortunately, have several businesses in the area that are not advocates, that they're just women in business. And they're like, the principles are the same, Terry, please coach me. So I've done that with a couple. I've got a girl that has an eyebrow business.
Is it exclusive to women? Could men join?
So men can join. I definitely, Zoom has taught us a lot. I am very conscientious to make sure that I am appropriate professionally, and that when I'm meeting with people of the opposite sex, that we're in public or on Zoom, I definitely want to remain a professional atmosphere. So is it easier for me with women? Yes, but I do have a couple of men that I've coached as well. And it's gone great. So
I interrupted you. I'm sorry. You were saying someone who was in eyebrow threading, was it?
Yeah. Well, they do I guess it's called eyebrow tattooing, but my eyebrows were done by her. Matter of fact, barter. So I bartered eyebrows for coaching. You know what I mean?
That's great.
And she made me look awesome. But she's, it was a couple of visits for me, but she gets me for a year. And she's, one of the things I love about her, she started her business. And one of the questions I ask is, how much business debt do you have? How much money do you need to make to pay your debt? And she couldn't answer those questions. So I'm like, okay, before we go anywhere else, we need to answer those questions. Are you on a budget? What's your goal? Is your goal to leave your full-time job to do this full-time? So those are the kind of the things that I would say. I'm going to say young people, but it's not always young people. Sometimes it's a new field and it's scary and you're not sure how to jump in,
What's the easiest way for people to reach out to you? Is it through your website?
Yes. My website is one of the easiest ways to reach out to me. I'm also on Greater National Advocates, also on the BCPA. And I just started learning, and I'm going to butcher this, but I took a class the other day on how to use my mapping to be able to create ways for people to find you in your local community and across the United States. And we just started doing that about a week ago, and I'm getting a lot of traffic from that. And
you're mapping? I haven't heard of that.
It's called My Google Maps. And what you do...
Google Maps. Got it.
No, not Google Maps. It's so it's personal. So what I do is for example, I want people in Collin County, when they're at the hospital and they think they need an advocate, I want them to find me. So I created all of the hospitals in Collin County, and I created a little blurb and I put the website to my address. But then the other thing I did is I did some layers, and I put local pharmacies, local caregivers, and all of it drives back to my business. So if you're sitting in the ER in McKinney and you type in anything for navigator, healthcare, whatever, my business pops up.
Oh, wow.
Yeah.
That's great. Great idea. Great
So
tip.
that
I'm gonna
is
look into that.
I'm a part of a networking group that does training, and that was one of our trainings 2 weeks ago, and it is absolutely changed. And you don't pay for it, guys. It's free. So it's
Wow.
awesome.
Great tip. Great
Yeah,
tip.
free is for me.
The link to your website will be in the show notes, but anybody listening to this in their car or anywhere and can't see it, it's SunNav HCA for healthcare advocacy.com. So it's Sun and then Nav, SUNNAV HCA.com to get in touch with Terry. Terry, thank you so much for being here and sharing all of your stories and your wisdom. I really appreciate it.
Thank you so much. We love you guys. We love Greater National Advocates.